Some kids can't wait to get braces. They see them as a sign of maturity or entering their teenage years. Others worry about what they're going to feel like or what they'll look like with braces on. But however your child feels about braces, you may have some concerns and questions of your own about whether your child really needs braces or not. I'm Dr. William Park with Bless Smile and Smile New Dentistry. Today we'll talk a little about whether or not your child really needs braces, and we'll answer some of the questions that you may have as well. Braces or other orthodontic treatment go beyond basic oral health and hygiene to really address some bigger issues such as jaw alignment, your bite, and function. Properly aligned teeth are easier to clean and maintain, and this helps to avoid risk of gum disease and cavities. A proper bite is also very important in helping to support good biting, chewing, and speech development, especially in young children. Teeth and jaw alignment issues in children are fairly common and can happen for a number of different reasons. This can include habits like thumb sucking or a baby bottle habit as a child, dental disease, or even trauma from accidents. The American Association of Orthodontics generally recommends a child see an orthodontist for a consultation around the age of 7. But certain conditions involving issues with jaw growth or improper teeth development may need a consultation as early as age 5 or 6. Treatment may not begin this early, but a preventative consultation will help prepare you and your orthodontist to create a plan for the future. Some signs that your child may need orthodontic treatment include things like difficulty chewing or biting, grinding of the teeth, especially at night, mouth breathing habits, other habits such as finger sucking, thumb sucking, nail biting, crowded, misplaced, or blocked teeth, jaw shifting or clicking, early, late, or irregular loss of baby teeth, or a misaligned jaw, including things like overbites, underbites, or cross bites. Early diagnosis is really key in orthodontics. Some orthodontic issues may be easier and quicker to fix if they are identified early and treated earlier rather than having all the adult teeth come in and then try to move things around from there. Sometimes even early or interceptive treatment may be necessary while your child still has some of their baby teeth in order to allow the adult teeth to properly come in. Orthodontic treatment not only helps to improve the aesthetics of your child's smile, but also helps to prevent potential problems in the future, such as diminishing dental health, dental pain or discomfort, difficulty in chewing or speaking, or difficulty in receiving dental care in the future. I hope that helps to answer some of the questions that you may have had about whether your child needs braces or not. If you have any concerns about your child's orthodontics or have noticed any of the signs that we mentioned before, make sure to make an appointment with your orthodontist to have an in-person evaluation. If you have any other questions or concerns about anything related to dentistry, please leave a comment below, and thank you so much for watching.